development of the AIDS. At this stage, the body becomes highly susceptible to opportunistic infections and certain cancers also, which can be life-threatening. So this was about the introduction of the AIDS. Epidemiology, if we see that how many people are suffering from the AIDS, then if we see the global prevalence of HIV/AIDS, it continues to be a major public health concern. As of 2023, there are approximately 38 million people living with HIV worldwide, which has been updated by WHO as 39 million people. So if we consider 1 million people are every day being added. Transmission rate, if we see, sub-Saharan Africa is the region most affected by the HIV or AIDS epidemic with the highest number of cases. However, HIV is a global issue affecting people in all regions, including East European, Asia, and Americas. Some new infections have also been updated with the HIV itself. That is, despite of global efforts to combat the view of the AIDS, still an estimated 1.5 million new HIV infections are every year being added. So we can understand that HIV is higher among certain vulnerable groups, which are including men with men and some of the sex worker sections where drugs are being taken. Risk factors, if we see, unprotected sexual activity, having unprotected sex with an infected person, either it is through vaginal route, anal route, or oral route. It is the most common method of transmission. Sharing the needles or syringes, uh, this is the commonest thing which we have seen in the young people, adolescent people who are in the just age, who have entered the age of the puberty and are going through the adolescent stage where they are being fascinated with various types of drugs, various kinds of fanatic opportunities provided by their peer group, where they share this kind of needles or syringes to take the drug substances and they get infected with the HIV infection. Many a times it has been seen accidentally also in cases of blood transfusion and organ transplantation where people or person has received the contaminated blood or organ, especially in the regions with inadequate screening, and can result in the HIV transmission. Mother to child transmission, which we also known as vertical transmission, where HIV can be transmitted from an HIV positive mother to her child during the pregnancy, childbirth, or during breastfeeding also. And the most commonest risk factor, that is having multiple sexual partners. Nowadays it has been a new trend in the Gen Z's to have in the situationship where they are not in any type of a particular relationship and they are involved with this kind of sexual relationship with more than one partners. So having multiple sexual partners engaging in risky sexual behavior increases the incidences and the exposure to the AIDS. Focusing on the pathophysiology, because why this pathophysiology is the important aspect. If we would be knowing the pathophysiology and the causative aspect, then we would be knowing that at what level the patient has occurred or appeared to us, and on the basis of the causative aspect we would be able to find out its mental symptoms, we would be able to find out its constitution, and ultimately the individualized homeopathic remedy will be obtained. So we would be exploring first the pathophysiology and then the etiology. In pathophysiology, the moment the HIV virus has entered into the body, it's primarily transmitted through blood, semen, vaginal fluids, rectal fluids, and breast milk. It enters the body through mucosal surfaces such as vagina, urethra, or rectum. This is the entry point. Now, for the prevention also, for treatment and management aspect, we can stop at this first aspect itself, that stopping the entry of HIV virus in our body. Targeting the CD4 cells, the virus infects and destroys CD4 plus T cells, which are crucial for immune response. So, if we see overall aspect of AIDS, it is not the disease, the AIDS, which is killing the person or which is making the person injured. It is these immune cells which are being immune response, which is degraded, causes the entry of all the other type of diseases, and due to which the lethal or fatal aspect of the disease is being encountered. These immune cells are responsible for activating other immune cells like macrophages and cytotoxic T lymphocytes. So, if the immune response is not available, these kinds of cells are going to develop in our body, and then ultimately they might be lose the sense of identifying the cells of our own immune response and cells of the foreign body, which is leading to the immune system dysfunction. Over time, as the number of CD4 cells declines, the immune system becomes severely weakened and the body becomes more vulnerable to the infections and cancers. Progression to AIDS. AIDS is diagnosed when a person's CD4 count falls below 200 cells per microliter of blood, and this leads to the surge in opportunistic infections for cancers. So this was about the pathophysiology of HIV. Next, we come up to the etiology of HIV/AIDS. What are the etiological factors? The main causative pathogen, that is human immunodeficiency virus, is classified into two types: HIV-1 and HIV-2. One is most common and widespread type, responsible for the majority of HIV infections worldwide. And HIV-2, primarily found in West Africa, is less easily transmitted and progresses more slowly than HIV-1. So if we see, HIV-1 is the, we can say, more toxic viral strain out of HIV-1 and HIV-2. HIV is transmitted through contact with infected bodily fluids, including blood, semen, vaginal fluids, rectal fluids, and breast milk. Sign and symptoms of HIV and AIDS. Acute, it has been divided into two parts, that is HIV, acute HIV infection and chronic HIV infection. Acute HIV infection may be expressing itself into 2 to 4 weeks after exposure. But if there are no sign and symptoms, or if we can see no expression of the disease, then the person may enter into the chronic infection stage, which is the latent stage, in which no symptoms occurs in a drastic manner. But if we see for a longer period of time, then the process, or we can say then the symptoms, may be developing gradually and gradually weakening the immune system. But in acute case, it has been expressed with fever. It starts with the fever, where we can express it as pyrexia of unknown origin, where we cannot find out what is the main causative aspect, where on the carrying out all the blood investigations, there might be not reflection of the any kind of uh, pathogen, but fever is present in the particular person or particular individual, which may lead us to diagnose the pyrexia of unknown origin. Then after, we will see here in the laboratory investigations also, that what are the investigations which can be undergone to find out the causative aspect of this fever, particularly in HIV. As we know, anytime if the body is being encountered with any kind of disease, then the lymphatic nodes are the part of the body which acts as the first line of defense by producing lymphocytes. So at that place, more production of the lymphocytes will take place, and which will lead to the swollen lymph nodes. Most abundant lymph nodes are present in our throat itself, leading to tonsillitis and sore throat. It may sometimes also develop allergic conditions, that is, like rashes, and most uh, common aspect of any of the viral infection, that is the pain in the muscles and the joints. That is also being seen in the sign and symptoms of HIV. Diarrhea may occur, headaches, recurrent headaches of unknown origin or unknown aspect. And all these symptoms are, we can say, resemble to flu-like illness. And many people may not realize also that they are infected, because all the symptoms which we discussed right now were all leading to, or were all, we can say, misguided in a particular type of a viral infection or flu-like illness. So we conclude to the sign and symptoms and move forward to the particular aspect of the sign and symptoms which are very peculiar to AIDS. Once the immune system is severely compromised, the individuals may develop symptoms related to opportunistic infections and diseases such as chronic diarrhea, weight loss, cachexia, which we can see. Weight loss can be again misguiding to diabetes, also tuberculosis, also. But for the particular identification of the cause, we need to go undergo for the laboratory investigations. So, chronic diarrhea, weight loss, persistent fever, night sweats, dry cough or shortness of breath, memory loss or neurological impairment, recurrent infections, pneumonia, tuberculosis, Kaposi's sarcoma, or other cancers which leads to the lymphoma. That is the particular aspect of, we can say, regarding to the development of the swelling of the lymphatic nodes. Um, is my PPT and all visible, and am I audible thoroughly?
Yes, sir.
Okay, as someone raised the hand, so just I was asking. Any question?
Sir, I hope after the entire session, question and answer session will be a better thing, sir. I hope.
That's better, but someone just raised the hand, so I was asking.
So, respected participants, if you have any question, kindly put it in the chat box then.
Okay, madam. Okay. So moving on to the further aspect, that is the main key aspect, that is laboratory investigations, where we have to find out the culprit, or where we have to find out the main aspect of the HIV infection, that how it can be diagnosed or how it can be identified, that whether the infection is due to HIV infection or any other kind of infection. So laboratory investigation, first and foremost, that is the antibody test, where we can identify directly that it is an HIV infection or any another kind of infection. These tests detect the antibodies against the HIV in the blood, indicating that a person has been infected. The ELISA test, or we can say the enzyme linked immunosorbent assay, is the most common test which can be undergone if the, we can say, any of the sign and symptoms are being particularly known for the HIV. HIV RNA PCR polymerase chain reaction. This test measures the amount of HIV in the blood, what is the viral load. Once HIV antibody test is positive, to identify the level of the spread of the HIV, we need to undergo this HIV RNA PCR, that is polymerase chain reaction. As in COVID, how we were conducting the HRCT. First, the identification was done itself with the RT-PCR, through which we were able to know that it is positive. House test kits were there, so they were able to know that whether the individual is positive or not. Then we were undergoing this RT-PCR and the HRCT to identify the viral load which is present inside the body. So same mechanism has been adapted in the HIV cases also, where HIV antibody tests, if occurs to be positive, Then we go on to the HIV RNA PCR. So to identify whether the viral load is more or less, or what is the level of, we can say, so that we can identify what is the stage of HIV in the individual. It is used to diagnose early infection, also to monitor treatment effectiveness and predict the disease progression. So it is very helpful in the process of prognosis and the management of the HIV. If a person is diagnosed on HIV and has been put up on the treatment aspect, so whether the treatment which is provided is effective or not can be also identified with the help of HIV RNA PCR. In one of our case at our hospital also, we treated this HIV infection where we were able to manage the PCR load when it was reduced effectively to almost one fourth when then the aspect when it was diagnosed. So this HIV RNA PCR test is very much helpful to identify the what is the condition and what is the case management of the particular individual. CD4 cell count also helps. This test measures the number of CD4 T cells in the blood, which helps to assess the degree of immune system damage. So again, once the HIV antibody test is positive, it doesn't end our task. We need to identify all these aspects also. How much is the viral load? We need to manage the viral load with our medicines. How much is the count of CD4 cell at present? If the CD4 cell count has been decreased to an more higher level, then it is first and foremost thing to identify how it can be stopped, or how the damage can be stopped or prevented more further. So all these aspects helps us to identify the CD4 T cells count. HIV drug resistance testing. This is done to check for mutations. This is done to check the mutations in the virus that may reduce the effectiveness of antiretroviral therapy. We are going to explore. Just a second. Is the screen visible now? Okay, so continuing with the laboratory investigations for HIV and AIDS, other laboratory tests also includes the complete blood count (CBC), liver and kidney function tests, and screening for the opportunistic infections for tuberculosis, cytomegalovirus, toxoplasmosis. As we already discussed, that it is not the AIDS or it is not the HIV infection which is really killing or which is really fatal for the individual, but it is the weakened immune system which is targeted by the other aspects also, which is leading to the development of the AIDS or various other diseases like tuberculosis, cytomegalovirus, and toxoplasmosis, like diseases in the organism. Differential diagnosis, if we see, It can be generally mistaken with the following aspects. It has similar symptoms, which will be explaining or exploring with the help of differential diagnosis with these cases. When it is just only the early stage of the HIV infection, it can be also just uh, mistaken as acute retroviral syndrome. Early HIV infection can resemble flu-like illnesses or other viral infections, example mononucleosis. It can be also taken as hepatitis B or C. These viral infections can also present with similar symptoms like fatigue, jaundice, and liver abnormalities. Syphilis and other sexually transmitted diseases. Certain STIs may mimic symptoms seen in HIV infection like gonorrhea, syphilis, tuberculosis, TB, and other opportunistic infections can occur in HIV patients and should be differentiated also. Cancer can be also seen because when HIV is being infected, person is being infected with HIV infection, then at the particular time, lymph node involvement is also seen. So, in the case of lymph node involvement, it can be also mistaken with the Kaposi sarcoma, lymphoma, that is cancerous stage. These may develop in later stages, that is the more advanced stages of HIV, where person cannot identify, has not early detected the HIV or AIDS, and it also need to be ruled out with its laboratory investigations. Now we are coming up to the conventional treatment part, where the first and foremost, as soon as the person is being diagnosed with the AIDS, he or she is being put up on the conventional treatment of ART, that is antiretroviral therapy. ART is the cornerstone of the HIV treatment, consisting of a combination of three or more drugs from different classes to suppress the virus. As we have seen that in tuberculosis, there is given up of the 4 to 6 drugs, that is ZEHR. Similarly, ART treatment is given in the HIV, where three antiviral drugs, combination of the three antiviral drugs has been from the different classes to suppress the activity of the virus, which may include nucleoside reverse transcriptase inhibitors. As this HIV virus is the RNA virus, the reverse transcriptase process is being adapted by the virus to spread its more toxicity and more virulence in the individual's body. So, reverse transcriptase inhibitors are the first and sorry, reverse transcriptase inhibitors are the first and foremost choice of drug for the particular organism's HIV treatment. Non-nucleoside reverse transcriptase inhibitors, protease inhibitors, because all the viruses are going to adapt the protein bodies of the organism itself. So protease inhibitors are the first and foremost, again, the mode which can inhibit the activity of the protease enzyme. Integrase inhibitors, INSTIs, entry inhibitors, ART, does not cure HIV but reduces the viral load to undetectable levels, allowing the immune system to recover. Prophylactic treatment. People with HIV or AIDS are often given medications to prevent opportunistic infections such as pneumonia with antibiotics or tuberculosis. As we have already learned from the previous slides, that in cases of HIV, the immune system is being drastically damaged. So they may encounter with these opportunistic infections like pneumonia or tuberculosis. So in that cases, prophylactic treatment is also started along with the ART. Management of the opportunistic infections. This may involve antifungal, antiviral, or antibiotic therapies depending on the specific infection a person develops. If a person has developed a fungal infection, then antifungal is used. If any viral infection has encountered the organism, then antiviral is being used. Or antibiotic therapies are always the line of treatment for a person infected with HIV/AIDS. Regular monitoring is the very important aspect of the treatment for HIV/AIDS person, because here and there, now and then, they are going to get encountered with any super added infective agents. So, what is their WBC count? What is their complete blood count? What is their viral load? What is their CD4 count? All need to be monitored at particular regular levels and regular intervals in the follow-up visits. Patients undergoing ART should have regular follow-up visits to monitor viral load, CD4 count, and drug side effects. If any antiretroviral treatment is going on, so at that particular time period, a person, if is developing any side effects due to drugs, then also need to be monitored. Supportive care, if we see treatment of symptoms like pain, diarrhea, or weight loss, as well as psychosocial support, which is the very important aspect of the treatment for individuals living with HIV, is essential for improving quality of life, which we will discuss in the further aspect of the homeopathic management. Psychosocially, the person or the individual who is living with HIV is very much depressed and is under nervous breakdown itself. So, a person is requiring the psychosocial support for individuals living with HIV. How and we can provide, and in what ways we can provide, that we will be exploring at the end of this session. How we can manage now AIDS with the help of homeopathy. So, this is the very important aspect where we need to identify the, or we can say, the potential of the holistic homeopathy for treatment of the AIDS. Homeopathy is a holistic system of medicine that treats the individual as a whole, and considering the physical, emotional, and mental well-being. It uses highly diluted substances that, according to the principles of homeopathy, stimulates the body's own healing mechanism. As per our philosophical aspect, as per our the organon point of view, we know that our vital force is the main and the supreme power which is enhancing our immune system. And the immune system is only affected in the HIV case, in the AIDS disease. So the homeopathy becomes the most potential pathy where it can enhance the immune system by empowering the vital force. When it comes to managing HIV or AIDS, homeopathy is typically viewed as an adjunct to the conventional treatments rather than a standalone therapy. While there is no homeopathic remedy that can cure HIV or AIDS or eliminate the virus, certain remedies may be used to support the immune system, and alleviate the symptoms and improve overall well-being. In most of the cases, people say as that the HIV cannot be treated with or cured with the help of homeopathy, but and it has been seen as an adjunct, or we can say the adjuvant therapy, that is the supportive therapy. But many of the homeopathic medicines are there which can also not only develops the vital force of the organism, but it also helps in avoiding the side effects of the ART, that is the entry retroviral therapy. So here also it is helpful to identify in some of the cases which we will see in the further slides. So the homeopathic management of the AIDS is mainly based on the miasmatic medicine of the organism. If a person is given the anti-miasmatic remedy, the individual is going to heal very quickly. So it is better to identify first of all the miasms which are playing the role in the spread of the disease inside the individual's body, and how the pace is there of the development of the disease inside the organism, which will help us to identify the anti-miasmatic remedy for HIV or AIDS. Homeopathy also addresses miasms, inherited or acquired predispositions to certain diseases. The concept of the miasms is foundational in understanding the chronic diseases from a homeopathic perspective. In case of AIDS, the soric miasm represents a state of weakness, unresolved chronic diseases, and susceptibility to infections. It can be related to chronic conditions that affect the body's resilience to disease, as seen in the immune suppression characteristic of HIV or AIDS. Remedies like sulfur, calcarea carb, natramure may be used to treat individuals who have soric predisposition to the chronic illness, such as AIDS. Tubercular miasm is often linked to chronic infections, particularly those affecting the lungs and the respiratory system. Tuberculosis is a common opportunistic infection in individuals with advanced HIV or AIDS case. So the tubercular miasm is associated with individuals who have tendency to develop tuberculosis, emaciation, and chronic fevers. Homeopathic remedies for this miasm include tuberculinum, Kali bichromicum, and Calcarea fos. Cancerous miasm, it is thought to predispose individuals to chronic diseases that can lead to degeneration and growth of abnormal cells. People develop with HIV/AIDS may develop cancers such as Kaposis sarcoma or lymphoma, which may align with the cancerous miasmatic tendencies. Remedies like Conam maculatum or met calcarea carb may be used to address cancerous tendencies in the AIDS. Syphilitic miasm, if we see, the syphilitic miasm is often associated with the debilitation, degeneration, and suppressed immunity. The syphilitic miasm is linked to individuals who may have history of a suppressive treatments of chronic illnesses. People with HIV/AIDS may manifest symptoms such as wasting, emaciation, skin ulcers, and opportunistic infections, all of which are associated with the syphilis in the homeopathic thinking. Remedies like mercurius, syphilinum, and kali iode are often prescribed to address the syphilitic miasm and its effects on the immune system. Repertorial approach of HIV/AIDS. If we see in most of the repertories, except the clinical repertories, nowhere they have especially given the disease such as AIDS. But what is to be done is we need to identify the symptoms of the AIDS which are presenting in the organism. The repertorial approach in homeopathy involves using a homeopathic repertory to identify and select the most appropriate remedy based on a patient's symptoms. A repertory is essentially an index or catalog of symptoms which organizes remedies according to specific characteristics, both physical and mental. The repertory helps a homeopath to match the symptom totality. Although AIDS is not explicitly listed as a disease in classical repertories, we can use a symptom based approach to repertorize the various manifestations of AIDS, such as chronic infections, fatigue, skin conditions, diarrhea, mental emotions, and other related symptoms. So, how to approach repertorially? Identifying the key symptoms. HIV or AIDS presents with a wide range of symptoms, so both physical and psychological aspects should be undertaken. When using a repertory, a homeopath will focus on key symptoms that represent the totality of the disease, which can be listed as physical symptoms, which include fatigue, weakness, which are the hallmarks of HIV/AIDS, chronic diarrhea, which may be often due to opportunistic infections or the side effect of ART, fever and night sweats. Many a times there is nightly development of the fever. Opportunistic infections such as tuberculosis, pneumocystis pneumonia, candidiasis, wasting syndrome. It is the significant weight loss and muscle wasting which we see in the case of AIDS will be leading to the AIDS. Skin conditions like lesions, rashes, ulcers may be also approached. Mental and emotional symptoms play a very important role in the case of AIDS, where people are suffering from the psychosocial trauma. They may be this may these mental and emotional symptoms would help us to find out the key remedy for it. Depression, a common symptom due to the chronic nature of the illness and its emotional toll. Fear and anxiety, fear of death, fear of infecting others, and anxiety due to the unpredictable course of the disease. Grief over the diagnosis and impact on the patient's life. Despair, a feeling of hopelessness or sense of impending doom. Irritability and frustration due to the chronic nature of the illness and the long term treatment regime. Step 2, repertorizing the symptoms. This is the very key symptom described above also. These are some of the rubrics taken from the Kent repertory, which would be helpful to identify how to particularly repertorize the case of AIDS. Selecting, and the step 3 is the selecting the remedies, commonly indicated remedies, which we are going to explore right just in the few minutes. Medicines which are indicated from the repertorial aspect I have listed in this presentation. Arsenic is the leading remedy in the cases of any viral condition or any flu-like condition. It is often prescribed for the individuals who experience anxiety, weakness, and fatigue. It is also useful for people suffering from chronic diarrhea. Symptoms which may lead to the selection of arsenic is emaciation, extreme weakness, anxiety, which worsens at night and may have burning sensation or desire for warmth. Phosphorus is also a leading remedy in cases of AIDS. Phosphorus is used for people who are emotionally sensitive and have a low immune response. It may be helpful in managing bleeding gums, coughing, and respiratory infections. Symptoms which leads to the selection of phosphorus are excessive thirst, dry mouth, frequent colds, and susceptibility to infections. Weakness and fatigue also are the hallmark over here. Another remedies are silesia, symptoms like suppressed immune system or immune function or chronic conditions, poor wound healing. Tuberculosis is also a remedy we already discussed in the aspect of the tubercular miasm, where symptoms like chronic cough, tuberculosis, poor appetite, weakness, lung infections, respiratory diseases are a concern in the tuberculum. Lycopodium also is a choice of remedy where digestive disturbances, chronic diarrhea, fatigue, lack of energy are the presenting symptoms of the case. Natrum mure also is a very wonderful remedy where eating well but not growing well is the key symptom of the disease, where symptoms such as depression, sadness, and grief are also being seen, feeling emotionally withdrawn, which bottles up the emotions and toggles the cases. So Netromure is very important remedy and key remedy in the cases of depression or psychosocial breakdown, nervous breakdown after the diagnosis of the disease. Califos, mental exhaustion, nervous weakness, depression, fatigue, nervous debility. Echinacea, it is the herbal remedy, but also our homeopathic aspect is being seen in the echinacea. In cases of the skin rashes, immune system which has been weakened can be also developed with the help of echinacea. Recurrent infections can be prevented, and cold-like symptoms also can be treated. Supportive measures in homeopathy, which we see it as the auxiliary measures. Homeopathy also includes remedies and aimed at the supporting general well-being in individuals living with HIV/AIDS. This might be used to address chronic fatigue, pain, emotional disturbances, and other common challenges faced by the people with HIV. Mental emotional support, remedies for anxiety and depression like argentum nitricum, aconite, ignatia can be also taken care of. Emotional health healing, homeopathic treatment which aims to support emotional healing can be also be the long-term illness like HIV. Energy and fatigue, remedies like china, gelsemium, natrum phos also can help in the individuals suffering from chronic fatigue or weakness in boosting vitality and improving energy levels. So, concluding my session, in homeopathy, HIV or AIDS would be seen not just as viral infection, but as an illness that reflects a deeper systemic imbalance, potentially affecting the individual's physical health, mental, emotional well being, and also disturbing the vital force. Homeopathy may offer symptom relief and enhance quality of life for individuals living with HIV/AIDS, especially when combined with conventional medical treatments. When approaching a chronic complex illness like HIV or AIDS, homeopathic treatment considers both the constitution, that is the physical and emotional aspect of individual, as well as the miasmatic background of the disease. It should be always be used cautiously as comprehensive treatment plan that includes both ART and adequate medical monitoring. So, ending my session with a thank you note to Dr. Kinshuk Goswami sir, who has always motivated the young speakers and has given the beautiful platform to showcase their knowledge. Also, I'm highly thankful to Lavanya ma'am for coordinating for the smooth conduction of the webinar. I'm also thankful to BJN for being a media partner and letting the aspect of AIDS to each and every corner of not only India but globally also, so that people can visit all these recordings and all these PPTs to acknowledge the awareness sessions organized by Aisha. Thank you to all of you, and a special thank you to the audience who have patiently attended the session. Thank you from my side, and concluding the session from my side. Over to Lavanya, ma'am.
Thank you, sir. Thank you so much. It's our great privilege to have you on the board, and I hope it's a great section for the participants too, sir. Respected participants, the question and answer session is open now. If you have any questions, just have it in the chat box. Sir, actually, I have a question, sir. How about their diet and absorption, sir? Because as we all aware that in the patients, the diet and the absorption which they are taking also very low. But how far we can suggest them the diet, sir, as far as the diet is concerned?
Uh, in case of diet, we would be helpful to them by auxiliary regime, which is always improving the immune system. That is antioxidants in cases of just as like we right now observed that in many of the cases immune system is not so much considerable. So that is also an important aspect of diet having antioxidant characteristics. Another thing that we maybe use, that is hello.
Sir, you were audible, sir.
So in case of particularly the diet, green leafy vegetables are mostly suitable. Another thing that is the citrus fruits such as orange or sweet lemon and all. And in cases of sarcoma, or in cases of cancerous condition where CD4 T cells are being very much has gone broken down, in those cases, and in the cases of low HP, dragon fruit is also very useful in cases of all these things. More fibrous food is, uh, we can say, advantageous in cases of AIDS.
Sure, sir. Thank you, sir. Thank you so much. Um, there is a question from the participant, sir. Is there any
Okay.
clue to is there any clue to show evolutionary link with syphilis and gonorrhea since long dates back?
Actually, I didn't got the question. What they are asking?
Sir, as far as I understood, is there any clue related to syphilis and gonorrhea related to this AIDS a long back? Is there any clue, sir?
Clue means they are asking the exploring the potentiality of homeopathy in gonorrhea and syphilis.
They are asking the clue regarding the syphilis and gonorrhea linked with this disease, sir. Long back, is there any evolutionary link? कुछ एवोल्यूशनरी लिंक है क्या करके वो लोग पूछना चाह रहे थे सर सिफिलिस और गोनोरिया को लेके.
They may be superadded infections in along with the AIDS itself. All these three are totally different cases. Gonorrhea is the bacterial we can consider. Syphilis is again the viral disease, and AIDS is also the viral disease. So we cannot directly say that they have any kind of evolutionary aspect. But yes, we can see according to the development of disease. If we see, then we can surely say that on the basis of the miasmatic evolution, they are linked with each other. In gonorrheal stage, if it is there, then it is particularly to the psychotic miasm. If we see to the case of or the aspect of syphilis, they are into the syphilitic miasm. And in cases of HIV, where tuberculosis is there, in that condition, the whole aspect of the tubercular miasm is being seen. So in those cases, we can say that it has been with the evolutionary aspect. They are linked with them, but as such, there is no evidences of linking of the disease with all these three diseases. If we see miasmatically, then yes, they are linked with each other. But if in case of causative aspect, then we cannot say surely that they are linked with each other.
Sure, sir. Is there any other questions from the participants? They are welcome actually.
Any questions?
Hope they have all cleared the certain questions, it seems, sir. And thank you, sir. Thank you so much for the overwhelming session. It was a great session, actually. Sir, Mohit, sir, can we have the video, sir, of the conference? Mohit, sir.